You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, smile makeovers, but specifically sedation dentistry. My first guest says, don't let your fear of the dentist or dentistry keep you from having the smile you've always wanted. With us, we have Dr. Emigh. Dr. Emigh, welcome to the program.
Thanks, Randy. Thanks for having me.
Now, for people that don't know your practice, we've had your brother on the show. It seems like everybody in your family, they're all dentists. Is that right? Is that what you always wanted to be a dentist?
Oh boy, yeah, this is a bit of a long story, but my dad's a dentist, still is a dentist. He married his college sweetheart who was a dental hygienist, my mom. I followed his path into dental school. Growing up, I was the assistant when he'd come in for emergency visits. I'd hold the suction as a 6-year-old there.
6 years old?
Starting at 6. Oh, I was the greatest helper as far as I was concerned. I didn't know it was just his time for babysitting, but I thought I was doing great dental work at age 6. And then I got into dental school and met my wife there freshman year in dental school, and I married a hygienist, and so our whole family.
Your mother also?
My mother is also a hygienist, so we have a lot of tooth discussions around the dinner table.
Do you really talk about teeth when you get home?
We have rules that are broken all the time. It is the rule is no dental talk at the dinner table. It's not enforceable.
Get you guys going, it's hard to stop you talking about.
It is. It's tough to draw that line.
Now, with sedation, okay, so we're talking about oral sedation, and we've had discussions about this off camera, but you say there's a lot of people that their fear of the dentist, they don't go for years.
Oh yeah, yeah. People come to our office and they have not been to the dentist 10, 20 years, and it is fear of a lot of different things. There's fear of judgment. They're fear of they're afraid when they come in, we are going to be shocked at what we see. We're not going to be shocked at what we see. We've seen worse. We see it all the time.
Do they say that? Do they say?
They come in, and the common approach is they come in. Their mouth is covered. They don't want us to see it. They don't want to smile. They don't want to show anything because they're so scared of judgment. And bottom line is, we're here to help. The dentist is here to help. And if fear is what's keeping you out of it, that's not a problem anymore. We can make that happen. So there's fear of judgment. There's fear of discomfort. Yeah. People have had bad dental experiences in the past. People are walking around in public and they are so scared of smiling because they're afraid they're going to be judged by everybody else. And what they don't realize...
Do they tell you that, by the way?
They tell me, but what they don't realize is other people are going around hiding their smile because they're afraid of judgment too. And you can come in, nowadays, we can treat you comfortably and we can give you that smile to give you the confidence to go out, smile, show your teeth, be the one that's charismatic at the party. Be the one that's going to get that job interview when you're up for a 50-50 shot at somebody who doesn't have that charming, lovely, beautiful teeth that you have, Randy.
Okay, well, thank you very much. So sedation, though. Okay,
yes.
So now you do oral sedation. You have to have a special license or permit for this?
Yeah, there's an oral sedation license that you have to take lots of continuing education classes for to make sure we're doing it safely and properly.
Now, there are dentists, and I've interviewed them on this show, but off camera they'll say, Randy, we don't do sedation because I don't think it's necessary. Yeah. Do you think that's insensitive of the dentist? Because I get a little nitrous when I go to the dentist. Oh. And so when I hear somebody say that, I'm going, I don't think this guy gets it. It's miserable to be there.
Nitrous is fantastic, but I think from some dentist perspective, necessary might have a little bit of a different definition.
Oh, okay.
I feel that your teeth are important for your health and your well-being and your happiness. And if that nervousness or that fear is keeping you from taking care of yourself, then it's necessary.
So nitrous is popular then?
Nitrous is fantastic. It's a great level of sedation. My wife, very comfortable in the dental chair. Still, when she wants dental work done, she sits in our chair. She has nitrous, and it's 45 minutes of peace and quiet. We have 3 kids. That 45-minute time is gold if you have children. So it's a very good way to go about and help you relax in the dental chair. You do not have to be scared of the sound of the drill. When you're in the dental chair with nitrous, it's comfortable.
And oral sedation, I guess, is for maybe bigger cases.
Yeah. Oral sedation we see oral sedation for a lot of different reasons. It's either a higher fear that nitrous is just not enough, just taking that edge off isn't enough, or for somebody who's just really busy and we have to do a lot of work on them. We have one patient who comes in from Russia. She's only in town a couple weeks at a time. And so when she comes in, if she has work that needs to be done, we need to get it all done. She doesn't have, it's tough to fly back and forth all the time. So she sits in the chair. We get everything done in a couple hours. She's happy. goes back, spends time with her family, and goes back to Russia.
Now, some people get like an amnesia effect, you say?
Yes. Oh, yeah.
Like with the oral sedation?
Yeah. So we had one father who came in doing veneers on the top, veneers on the bottom, and we were seating the final veneers. They looked amazing, and his son was taking him to Vegas for a completion trip afterwards. They drove out to Las Vegas. I talked to them, didn't recommend gambling that night. He actually went out on a night of gambling, did not remember anything from that night. His son kept him out of too much trouble, didn't lose too much money, but just remembered nothing that whole night. It was
because
amazing.
of the oral sedation.
Because of the oral sedation. Yeah.
So it seems like, based on what you're saying, there's two categories of sedation patients. What? The fearful?
Yeah, we have the high fear patient and the busy person with a lot of work that just doesn't necessarily have time to come in, but has a lot that they need to get done in a short amount of time. And we see a lot from each side. That, you know, the nervous patient is really what you hear about more for the need for sedation, but it's not the only time we use it.
Okay. Now, you know, one of the things you said on our meeting on the telephone, you said that you like dealing with phobics.
I
don't mind it.
No, I actually really enjoy it. And this is going to sound weird, but realistically, their expectations are so bad of what's going to go on when they come in and they don't remember anything. I call them the night after treatment, and they say it's fantastic. There's no other way to do dentistry as far as they're concerned. They had a great time. They go home. They're not sore. It's amazing.
So there's a lot of people walking around that have the money, and their teeth are really bad, but it's just the fear that keeps them from doing something.
Oh yeah. There are people walking around.
So really, there's that many people that are afraid.
People walking around who cannot chew, who cannot eat properly. They have the liquid diet just because they are afraid of going into the dentist. That they don't have to have that. We can fix that. We can keep you comfortable. You won't even know you were there.
Are men worse at this, by the way, where they put it off until they just literally are in pain, and then they finally come in?
Are you going to get me in trouble here, Randy?
Okay. Because it seems like women won't do that. Like women will get things done sooner.
But women have a lot going on in their minds sometimes. That's a foot and mouth moment, isn't that, Randy?
All right.
People are afraid for different reasons. I mean, men don't tend to voice their fears quite as often. Women are better about getting it out there so you know what their concerns are. But we see a lot of each. We see a lot of each.
Now, when you say, you know, we talked on the phone, but that you could do like 6 months worth of procedures or dentistry in one afternoon, what does that mean?
Oh, so easily. I mean, we can do 10 years worth of dentistry in one afternoon. It is just, without getting too technical, it's just easier. If you are comfortable and you are happy in the dental chair and you don't have that anxiety that's keeping you moving around or wanting to get out of the dental chair because you're hearing the noise of the drill, we can do crowns on the upper right, crowns on the lower left, veneers, root canals, implants. It's just so much easier to get it done all at one sitting. Like if you are busy, if you're the CEO, you've got a business to run. You make a lot more money outside working in your office than you do in our chair.
Is that a big excuse? I don't have the time.
Oh, we hear that all the time. Yeah, and who does? Again, we have 3 kids. Trying to schedule their school and their schedules, that does not give us a whole lot of time to go around.
Mothers don't have time to go back and forth to the dentist.
No, they don't. So if you can drop your kids off at school, get all your dentistry done at the same day, it's fantastic.
So knowing what you know now, since you've been doing oral sedation for quite some time, you couldn't do it any other way? I mean, having it available?
Yeah, that's definitely a tool in my toolbox, and I could not imagine doing dentistry without it. There are so many cases that we've seen that they wouldn't come through the door if it wasn't for sedation, let alone sit in the dental chair. We had, about a year ago, a girl came in. She had an infected tooth for 2 years. And when she came in, this is an infection. She's dealing with an infection. Couldn't eat on that tooth for 2 years. She comes in, this tooth is killing me, doc. I go in and I get my mirror out. She goes, no, you can't look at my mouth. Yeah, kind of my job, okay. And she goes, it's hurting. I'm like, okay. I finally, after about 5 minutes of discussion, I said, I need to at least see what's going on. So when I basically look, put the mirror aside, look with my finger. Clearly, it's an infection. So we talk about, we're going to do sedation. She comes back in 2 days later. We sedate her. She doesn't, best dental experience she's ever had. She now comes into the office 6 months, every 6 months.
So they're back in the system.
She's back in the system. She's happy. She's healthy. She's now graduated. She just graduated just this last year. So, yeah, great.
Do you know, like when you get a consult, somebody that's really anxious, right?
Yes.
And they're afraid of the dentist, do you feel like you're going to convert them? Because you know, in the green room, you and your brother, who's a dentist.
Yeah.
I said, people don't like going to the dentist, right? And you go, no, I think it's changing. People like coming to us.
Yeah.
So do you convert them? I mean, do you have a sense like?
Most people we are able to really convert into happy dental patients. There are some people who are just never going to be super excited to go to the dentist, but then that's when we talk about nitrous. We talked about nitrous early. You come in there, it's your 45 minutes to relax. It's a great way to.
It really is that good. It's like the spa.
Oh, absolutely, absolutely. We got massage chairs. You sit back, relax, put some TV on top of you. It's great.
You know, we say things like at the top of the show, don't let your fear of the dentist keep you from having the smile you've always wanted. And you talk in terms of transformations, that you change their teeth, and for some people, it's a life change.
Absolutely.
Elaborate on that.
Absolutely. Well, you know, I think I mentioned this earlier. If you show up to a party and you have people sitting around talking, but you have that one person on the far end of the room who's got that big smile and they're talking, it's that confidence. When you walk
charisma.
It's charisma. Charisma is the right word for it. You walk into the room and that is the person people are drawn to. That's what a smile is. If you have, listen, I'm a dentist. I've seen all the studies on smiles.
You probably think it's important.
There are a million of studies out. Yeah, well, of course, I'm a dentist. I think it's important. But I look at the studies. The studies have shown even a fake smile makes you happier. The more you smile, it makes you happier. People think you're more competent with a good smile. If two twins show up for a job interview, one of them's got crooked teeth, the other one fixed her teeth, lovely smile, 9 times out of 10, who do you think's going to get that job?
Person.
So it's the one with the smile, the one with the confidence. That's who you want representing your company.
So if you don't like it, get something done.
Absolutely. There's
now, you mentioned amnesia a lot, and we have to be very, very careful on the show with disclaimers. Not everybody has amnesia with sedation.
No, but it's. I
mean, for some people, they forget.
It's not complete amnesia for everybody, but it's about 95% amnesia. You forget pretty much most of the time, and it's great. It is safe. We are able to talk with you during the appointment. You can tell us what you're thinking. It can be fairly entertaining sometimes, but you don't remember being in the dental chair. You remember showing up, and they usually remember something on the ride home. They've tried to convince the ride to stop by Carl's Jr. and get a cheeseburger or something like that. But they don't remember much at all.
And do they request it? I mean, how do they know that you guys do sedation?
Well, we do.
Because in Long Beach, you guys are the sedation guys.
Yeah. We do some marketing. We do some marketing around, but a lot of it is word of mouth. I mean, when you are afraid of the dentist and somebody makes you that happy, we have a lot of really satisfied customers walking away and spreading the word. Yeah.
People, now you've always known you were going to be a dentist, right?
Yeah.
That's the only job you ever wanted to do.
Since age, boy, as long as I can remember. Everybody wants to be like their dad,
like
right?
you're in high school though. Yeah. And you guys were already known as the dentist.
Yeah, I'm the weirdo that wanted to be the dentist.
So there was
in high
no
school
question that you were
going
to be anything else.
From day one, it was plotting my course how to get there.
Is that right? So dental school must have been easy with everybody in the family being a dentist?
Dental school was still a little bit of work. It was a little bit of work to get through there, but it was. I had a lot of dental exposure beforehand when they're introducing things like crown work, and it's all what I knew of. But you learn how to.
Now you brought some photos. What are we looking at?
Sure. So
because you're saying sedation, allowed these people to take care of their smile.
Absolutely.
That normally would no way have done anything.
Absolutely. Now this is one of my favorite stories. So I'll show you the picture, and I want to kind of tell you a little bit of his story. This is a young guy who had a plan for his life. He had a plan for his life. There were obstacles, but he set forward his plan, and he overcame it. Step one was to get his teeth taken care of. Now, he's terrified of going to the dentist, and he looks like he's a happy, confident guy, but the one thing he was really scared of was going to the dentist. So go to the dentist, fix your teeth. Step 2 was meet the girl. Step 3 was get the job. Step 4 was get married. So
is that right? I mean, he tells you this?
He had this planned out. So he comes into our office, and we've known him for a long time. We've known his family for a long time. Long Beach is a fairly small, big city. So he comes in, we talk to him, and we end up doing veneers up top. So 2 weeks later, he goes in and he comes back after we seated the crowns. I got the job. So. Did you meet the girl yet? No. Okay, your plan's off. 2 weeks later, we get a call, met a girl in a bar. Now, fast forward to now, he's married to that same girl he met in the bar. This is amazing. You don't always hear plans coming together like this, but they do. So, I mean, if you look at him, his biggest concern was, if you look, he's got space there. The teeth have darkened up a little bit. And they're just spaces. The teeth look small. So it's real easy to kind of lengthen those a little bit, close those spaces, and I think it looks he's got a great, really natural, fantastic smile.
They don't look like veneers. Those are veneers?
No, they look like natural teeth. This is not, you're going to pick it out as he has a great smile, not a fake smile. And I think he's very happy.
So you think he got married just because of his teeth?
I'm the dentist. Yeah, absolutely. Absolutely. No, I think it helped.
But it contributed to his confidence.
Oh, we talk about that charisma, about that person who's across the room at the party when you go in. He's in the bar. He's got that smile there. When he walked up to her, I don't doubt that confidence helped.
Now, when they see themselves in the mirror for the first time, like a guy like this, what's that like?
Oh, it's amazing. It is. You see, and they've had this guarded smile for a while because it's something they've held inside. They just weren't confident in showing the teeth there. But when they look you see something change. You see the sparkle in their eye and the pride, and we get tears all the time when we get that first reveal. It changes. You can see it changes how they feel.
Now the extreme phobics. I mean, some people, it's hard to even get them from their car to the office.
Oh yeah,
you told me.
Yeah, there are some people we have to give medication the night before just so they can get in the door, and then it's an hour before they come in. They have to take a pill just to get them in the door so they can sit down in the chair, and we can make that work. I mean, it's not as uncommon as you think it is.
Is it the fear of the pain? Is it just a gag reflex? I mean, what are they afraid of?
Everything.
Really?
Judgment. They're afraid of judgment. They are afraid.
Like are there dentists that judge people with bad teeth and bad mouths? I mean,
there are. I mean, some of the old history is people are afraid of being scolded when they go into the dental office.
Does that happen?
Not at our office.
But does it happen?
Oh yeah, absolutely.
The patients tell you that?
Yeah, oh yeah. But that's a very common report when they come in that they felt that their hygienist was scolding, that their dentist was scolding them for being away from the dentist for so long, as opposed to talking about why they were away for so long.
Okay.
And it's fear. It's fear of a lot of things. The gag reflex you mentioned is a real common one. If we have to take impressions, people don't like the impressions. Now, we take digital impressions now, so it's a little bit better for those patients who are afraid of the gag reflex. But sometimes people have a tough time with x-rays and need to be sedated sometimes.
So
for
missing teeth, whatever. I mean, you guys do implant. You do dental implants?
Yeah. We do a lot of. I did my externship in Columbus, Ohio, at Midwest Dental Implant Institute to place implants, and that's fantastic. If you were missing a tooth cosmetically, or just you want to be able to chew on your back teeth, yeah, implants are a fantastic option.
Now you brought more photos. What else are we looking at?
Let's see. So this is another one of my favorite cases. This guy came in and he says to me, for my wedding present to my wife, I'd like to fix my teeth. And we had about 3 months. We didn't have a whole lot of time. So when we're looking at fixing teeth like this, if you look here, his main concern was the space between his teeth. Now we see a little bit more than that, but his concern was the space between his teeth. He also has, we see that tooth over, the pointy tooth over there, looks at what we call a peg lateral, which is causing some, and he's actually missing teeth that he was born missing with, that's causing some of those spaces there. The teeth are a little bit dark, but the color is not his primary concern. So when we talk about options for closing spaces, it's Invisalign, it's braces there. We have 3 months, and that's not going to fix the lateral. So then we start talking about veneers and crowns. So with him, we decided to do veneers across, and all we did was 6 veneers. That is just 6 teeth is what we changed there, and it just transformed his smile completely. Very nice. Yeah, well, he looks great. He looks natural, and his wife is very happy. The marriage went through, and they are just. He's a fantastic person, and he had been living. Look at this. This was his smile beforehand. That below there that's his biggest he would smile beforehand. Now you see him. It's different. He shows teeth. Just that happiness shows through, and he's a happy person. He deserves that.
On the consult, you're talking to somebody, and they're nervous, and they're worried. Like you say, this is an occasion. So he gets oral sedation.
Yes.
With this particular person.
Yes.
And you just need a ride to, or You just need a ride home.
Yeah, yeah. Well, you need a ride too. You need a ride too. We like to have somebody to give them a ride to the office and a ride home. That is it.
That's only if they take a sedation prior to getting there.
We usually will have somebody take a pill before they. But
Really?
If you're going to be in the dental office under sedation, you might as well be relaxed from the second you walk in the door. There's no reason to be nervous.
They must be easier to deal with. I mean, as a dentist, if they're sedated, they're relaxed, right?
I love happy people, and when people come in sedated, they are happy. They're happy. It makes my job easier. It makes me. I have a happy day at the office. I get to fix people's smiles and people leave happy. It's great.
Now, we had a discussion in the green room, and to me, it was interesting. But like in Long Beach, I mean, you have the LA area, producers, directors, CEOs, busy people, moms with 5 kids, that some people just have they have the money, but it's an excuse that it just takes so much time. Yeah. So what do you say to those people?
Yeah, this is one day. He looks amazing. You look at that. We can transform your life, your smile. It takes one day. It takes one day.
In one afternoon.
One afternoon. People can find time for that, for something that's that important. I think we can do that.
Now, what if their teeth are just so bad, so far gone? Because you guys, I mean, the Emigh brothers, I'm calling you guys, because I had your brother on the show.
Sure.
But some people haven't been to the dentist in 20 years.
Yeah.
And they just want to eat and chew. But then the side effect is you get them eating and chewing, but now they got this beautiful smile. Elaborate on that.
Oh, well, you pick your priorities, eating and chewing and looking great and feeling great. I mean, it's 20 years. We hear this a lot. We hear this a lot. I haven't been in 20 years. And again, they come in covering their mouth because they're concerned. They're concerned we're going to judge what they have in there. And they walk out with new teeth and a new smile. It's one of the things I really enjoy most about what we do. Again, you can't describe the happiness. They go on. Again, we hear stories about that confidence. Guy's married now. Whether the teeth were the only reason, I'm sure they weren't. He's a wonderful guy. But that confidence, I don't think it's a coincidence.
So most of the stuff you're doing with this oral sedation, do people take care of their teeth for an occasion, for like they're getting married?
Well, there has to be some motivating factor. If you've been away from the dentist for 10 years, there's something that's getting you there, whether it's an occasion or whether it is just struggling to chew. We had a lady not too far back who showed up. She was actually not a happy occasion. She was getting divorced, and she was looking. She wanted to really change her smile. She'd been married for 20 years and was going to be out single again, and really wanted to. Help her self-esteem and be confident when she was up and out there. And so we did upper veneers, we did an implant up top, and really when you put the mirror in her hand and she sees that afterwards, you see just that sense of confidence that things are going to be okay. She feels better about getting out there, and when you get to see that, it makes what we do just a lot more rewarding. So, most of these people when they come in, they have been sitting on this, waiting for that motivating factor to come in for 10, 15, 20 years. And when we take care of it, it was so easy. They were so easy, they wondered why they went 20 years like this, unconfident in their smile, out there hiding their teeth, not able to chew.
So they lost some good years.
They lost some good years. Why waste those years? If you can come in, have this done, be happy with your teeth, be confident, we're only here one time. Spend your life happy, spend your life smiling.
So you think the smile, so they should invest in their smile.
Oh yeah. Yeah, listen, again, this is coming from the dentist. I'm a firm believer that smile,
How important is it?
Oh, your smile, again, is your confidence. It is what you walk into the room with. It is what frames your life. If you smile, you're happy. And I don't think there's anything more important in life than being happy.
Yeah, even like presidents, they say, have been elected because of their smile.
Oh, yeah.
The guys with the best smile seem to...
Oh, the studies have shown. The studies have shown. You have a smile, you are considered more competent. You have a good smile, you are going to be more successful. This is the study after study has shown this.
So sedation. Now, for people that come in and want the pill, the oral sedation,
yes.
Are they? Is it more women than men? More men and women? Is it a mix?
No, it's a fairly even mix.
And what are the age ranges?
Now, you can do sedation when you're younger. We choose to do sedation on adults 18 and over. Boy, we've done sedation. I think the oldest sedation case was 95 when we placed an implant to support her partial. Oh boy, and she was happy as can be. She was not able to chew on her partial. It was moving up and down. All we had to do was put one implant and attachment in there, and she's eating.
Now, do you see it like when you're out and about? You could, let's say they look good because you see it. They have the good skin, the hair, the nails, the whole bit. And you ever think, I wonder why they're not taking care of their smile?
It's something that you see a lot. I think, people, they have the Botox injections. You're getting injections on the forehead, injections on collagen in the lip, and then they still hide their teeth. And to me, now what I notice first is the smile. But we showed you those pictures. We showed you those pictures with the, people who have, just something black in their teeth. You notice that first. They walk. It's obvious. So
get it done.
Yeah, get it done. There's no reason not to. We can keep you comfortable. If you're nervous, that is okay to be nervous, but just know that people, we can take care of you now if you're nervous. We can make you comfortable. We can make you not even know that you're in the dental chair.
Are there even big tough guys
that
are afraid of the dentist?
Oh, big tattooed biker guys that are scared of the injection. And
really?
And that's all that's keeping them away. But then when they go out, again, they wonder why they waited so long because it's such an easy way to get things done.
Take care of your smile.
Yeah. Oh, yeah.
You hear things like change your smile, change your life.
Yeah. Oh, yeah. I'm a big.
Is that an exaggeration? Or you
No, not at all. No, I don't think that's an exaggeration at all. I just hear it all the time. Again, when people come into me, they say, I'm sure you've never seen this before. This is it. This is terrible. But we have. It's out there. I hear the story all the time.
Okay, good. I want to thank you for excellent. So final message, somebody watching this, they're going, I got to get in there, but it's a hassle. I don't have the time. I'm afraid of the dentist. Just invite them in. Is that?
Okay, yeah. There's no reason anymore to put it off. We can do it comfortably. We can do it. We can find time to make this happen. This is one afternoon we can transform your life.
Dr. Pat. They're going to ask for Dr. Pat.
Dr. Pat, come and ask me. We'll transform your
life. All right.
life.
Well, thank you for coming to the show. Great stuff.
Thank you very much, Randy. Appreciate it.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.